Coming up next on Arizona Horizon, sign up for the health insurance marketplace under the Affordable Care Act starts tomorrow. We'll hear from the administrator in charge of the marketplace in Arizona, and we'll also hear from a navigator who will assist those signing up for health care. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. A federal judge has ruled that Maricopa County cannot interpret a 2005 state law to mean that people smuggled into the country can be charged as conspirators to a crime. The judge ruled that such an interpretation criminalizes actions that the federal government classifies as civil violations. 75% of those charged under the smuggling law in Maricopa County through 2011 were charged with conspiring to smuggle themselves into the country. Registration for Arizona's health insurance marketplace starts tomorrow. Tonight, we focus on what to expect regarding the health care exchange. We start with a recent conversation with David Sion, the regional administrator for Arizona's Medicaid and Medicare programs. Good to have you here.
Thank you.
Let's start with, there's so much to talk about here. Let's define terms. The health insurance marketplace. What are we talking about?
We're talking about something as simple as a marketplace where you would go and there are vendors selling their produce, and you can look at the produce at the different vendors and decide what you like. It's that simple of a concept, so that we'll have health plans available for people to choose from, so people have choice. They'll be available on an internet site. It can also be accessed by telephone operators. Basically, there you've got a choice of health plans, so you have a choice that may represent different doctors and hospitals that are available. You've got eligibility for subsidies. So there's almost 1 million people in Arizona right now that don't have health insurance. Some studies show that somebody dies every day because they don't have health insurance in Arizona, that they don't get care that they need. And so we're going to fix that, because more than half of those people are going to be eligible for subsidies under the law that will reduce the premiums that they have to pay. But perhaps the most important thing is everyone's eligible as long as they're a citizen or a legal resident of the United States and have an address that they can use. There is no discrimination for people because they were ill in the past or they may have a genetic condition or something like that. There's none of that. Everyone's welcome to have insurance now.
Interesting. And again, no denial due to illness, no denial due to medical condition.
That's right.
All right. Sounds like one-stop shopping for basically the essentials.
What we're trying to do, right, is to facilitate this marketplace where you go, and whether it turns out that you might be eligible for the Access Medicaid program if your income is lower, or for one of these subsidies, or if you'd simply like to buy different health insurance and shop, you can do that. But when you look at automobiles, you have the large SUV and you have the convertible, you have these categories. Same thing here. 4 categories of plans: bronze, silver, gold, platinum. The difference there is you can pay a higher premium and then have lower costs during the year, or you could choose a lower premium, take a little bit of a chance, and then maybe you'll save money if you don't have much needs. But they're all going to cover the same 10 essential benefits, and that's very important.
Talk about those essential benefits. Are we talking hospitalization, drugs, these sorts of things?
We're talking hospitalization, outpatient prescriptions, outpatient care, physician services, laboratory, maternity and new baby care, basically all the things that you need to take care of your health.
And those are all required?
All the plans are required to offer the 10 essential benefits. Some may go a little further and have a richer benefit, but then the premium might be higher.
And again, we're talking basics here. These are all private firms.
That's right. What it is a marketplace of individual vendors, if you will, just like the example of a farmer's market. So it's not government insurance. Our role here, as insurance commissioners do as well, is to simply regulate that marketplace so that the issuers can benefit from a healthy competition, and the taxpayers and consumers in this case have an opportunity to make a meaningful choice.
Do we have an idea of how much these health plans will cost? Any level at all?
Right. We are not going to post the premiums until we have signed agreements with all of the plans. So that we have a full story to tell. We're in the middle of finalizing those discussions now, so I can guarantee you that on October 1st, folks will be looking at the premiums. But I can tell you other states who've decided to run their own exchange, California, for example, Massachusetts, have published their rates, and they're competitive and in many cases better than what was expected.
And you can find out, again, if you're eligible for what you would refer to in the past, these low cost. Are there free plans that folks could be eligible for as well?
Okay. Let's start from the bottom.
Yes.
So for folks that have a very low income, less than 133% of the poverty level, or let's make it simpler, less than $15,000 for an individual, 31 for a family of 4, those folks don't pay anything for health insurance because they qualify for access. And if they come to our health insurance marketplace portal or one of our navigators helps them, when our system determines you're eligible to be in Arizona's Medicaid program, that's where they're going to go. The system's going to take them over there and get them enrolled. If their income is higher than that, then the system's going to take a look and see if they're eligible for a reduction in the cost of their insurance. That happens on the scale from that 133% all the way up to 400% of the federal poverty level, which doesn't mean much to the viewers, but $94,200 probably does mean something. That is the level at which the subsidy would stop for a family of 4, and after that you're just buying insurance. This program isn't just for poor people or people that can't afford insurance, because anybody can go to the exchange, as I said, and buy insurance. But what's important here is there's a lot of people that we would think of as, you know, middle class folks that are going to get a reduction in the cost of their insurance because we're going to pay part of the premium for them and they'll just pay the difference.
Interesting. Children's health insurance programs, are they out there?
Well, children, lower income children have access to care through Arizona's Access program, yes. But when we get into the people in this middle class, these programs are available for kids, moms, whomever. You may have a family where my employer provides health insurance, but not for my son. I can buy a policy on the exchange for my son, regardless of his health status.
Okay, everything you've talked about right now makes sense when we're talking about it. When you go to the computer on October 1st, or go to the telephone, or I guess there's a variety, we'll talk
right.
about that in a second here too. But when you go there, is this laid out for you? Is it a follow? How complicated is the application process?
Well, I can tell you I was at our headquarters back east last week and actually had an opportunity to test drive the application process myself. And it's really quite simple because it asks you one question at a time. You know, where do you live? What do you expect your income to be next year? A few facts like this. The system behind the scenes goes out and verifies that these facts are correct using a facility that we call the Hub, which just yesterday passed its tests for readiness to start. And then it says, you know, discount, as they say on the TV commercials. It might say to you that you're eligible for a reduction in your premium of a certain amount, and then you can go on and browse the plans that are available. This reduction comes in the form of, little wonkish, an advanced premium tax credit, advanced paid tax credit. So what you're doing is you're getting, our friends in the Internal Revenue Service are actually giving you money. They're going to give money every month. When you pay your premium, they'll pay a share of it, or you can delay it and take your tax credit later. But the point is, when you get to the tax return in the following year, you're going to square up this credit. So if, for example, you were unemployed and then you get employed during the year,
yes.
You can go back to the marketplace and say, my income has changed, and then they'll adjust that for you. Just like you might adjust your withholding if you had another child or something like that. And then that's where it gets adjudicated. So if we paid someone too much, it'll come back. If we didn't pay as much as we should have, let's say you lost your job in the middle of the year and you didn't tell us, you could be eligible to recover some money there as well.
So again, when you get to the application process, it's kind of like a variety of things you do online where you can get fitted for a golf ball or something like that. You press a thing, continue. You press a thing, continue. And this will, because what you're explaining can be complicated, especially to folks who may not be all that well versed in the nomenclature of insurance and all this legalese stuff.
Right.
They want to be able to know, A, can they fill out the application? And B, once you're filling it out and I have options, can I figure out what the options offer?
And this is the thing, that the transparency, the opportunity for choice that we think is really powerful. So, you know, if I have a kid, let's say she's got Asperger's, you know, it's a problem that some kids have, and I need to buy insurance, I'm going to have to go to these different insurers, fill out some pretty sophisticated things about the illnesses that they've had and everything, and then half of them are going to say no, and the rest of them, maybe they're going to offer me products at different prices that don't match up. So there's no way I'm going to really make a good choice. Here, all the plans offer the same benefit package, the basic package. They're all available to me, And they are in lockstep with this bronze, silver, gold thing where I can figure out what premium I want to pay versus how much risk I want to bear. That's a much more logical way to make things work. We have a capitalist system in our country, and it's great, but sometimes these systems are helped by having a little structure to make the marketplace work better.
And the structure means comparing prices, comparing benefits, comparing quality of plans?
Well, now that's an interesting point. So the plans that will be offered on October 1st, or shall I say the products, as the issuers call them, they didn't exist prior to the 1st. So while we could give you information about this insurance company is pretty good or that one, it really wouldn't work so well. So what we're going to see is we'll know if it's a company that has accreditation or has some qualification that's worth knowing. But in terms of rating the plans, that's going to happen when we get into the next year and people have experience with the actual products in the exchange from that issuer.
I don't want to jump too far ahead, but will those ratings be like Amazon, where you just give it 5 stars or something like this, or say I like it, I don't? How do you figure that out?
We've been in this business a long time. So I've worked for CMS for 34 years. We've been administering the Medicare program since 1964. And about half the people that are in the Medicare program here in Arizona actually get their Medicare from a private plan. They're called Medicare Advantage plans. And all the folks who have the Medicare prescription drug program get that from a private plan. The way we do this is we have an engine, very much like the marketplace, called the Plan Finder. And if you're a Medicare beneficiary and you're interested in a drug plan, you go in there and say, this is where I live, this is the pharmacy I like, I need this drug in this dosage and this one and that one, and so forth. And then we pull the lever and the program figures out this program is going to have the cheapest overall cost for you, considering your dosage and all these other things. And then there's this one and that one. And then we give the plans 1 to 5 stars. And as a matter of fact, for the past few years, we did a demonstration in the Medicare Advantage side where we paid the plans that had 5 stars more money every month, which they used to enroll more people, and we drove people toward quality plans. And that's exactly what's going to happen in the marketplace. We will tell people the plans that have a higher satisfaction, we'll survey people, and then drive people toward those. And we're also going to look for plans that get better health outcomes by making sure people have preventive services and the like.
So there will be accountability in that system relatively soon?
Relatively soon, yes.
Relatively. Okay. All right. Again, I'm back now trying to figure out what I'm doing here on October 1st, 2nd, or 3rd. And I figured out, I've gone through the process, I've continued, I've done everything, I've made my choices. I enter, and whatever the screen says, thank you, good luck, and God bless. What if November comes and I decide, well, I think I want to change that. I'm not sure I want to go with Plan A here. I may want to go with Plan B with this other company. How often can you change?
Right. I gave a talk today, and a gentleman compared this, in his example, to a sale at a big box retailer where the store was going to close on a particular night, and then you could line up outside and there'd be a 70% discount in the morning, and everybody had to be there at once, and people got mobbed at the store like on Thanksgiving. This is not like that. There's nothing special about October 1st. The first enrollment period is 6 months long. So people have until March to decide if they want to participate. You can go on, go through the application, and save it, much as you would start a shopping cart in one of the other internet sites, and think about it. So the way this works is you're going to work through the business about the subsidy. If it looks like you're eligible for that, then you're going to say, okay, let me see the plans. And then you're going to see the plans and their information, and you're going to pick one. And then when you pick one, the computer's going to say, thanks very much, and welcome to XXX insurance plan, and now you'll be doing the particulars with them of how you want to handle paying your premium, which doctor you'd like to see, and so forth. Or you could get there and say, I want to think about this some more. I want to talk to my friend who's a nurse. I want to talk to my cousin, whatever. We think caregivers and family and pastors and teachers are really important in this process. Not a lot of people make this decision for themselves. I mean, frankly, I'm hoping for some of the younger folks who may have a little trouble with this. Mom's going to say, you know what, you need to have health insurance. Maybe even help them pay for it. So it's kind of a family and community thing. And I love working here in Arizona because we have so many partners in the community, in the healthcare community, that are really interested in helping people find their way through and get the right coverage.
Should folks be preparing now to enroll, or is it just basically wait till October 1st and take it from there?
You can go on our healthcare.gov website today and learn about how coverage works, what the benefits are, how the reduction works for those people that qualify for the advanced paid tax credit. But you really don't have to do anything much but wait a little bit. And then in October, as I said, you've got plenty of time. And I didn't answer your question, let me be clear. If you choose a plan in October and change your mind in November, remember that the coverage doesn't start until January 1st. So the plan that you're enrolled in on December 15th, that's your plan. And now you're in. For people who decide to go a little slower, their start dates will be February 1st, March 1st, April 1st. Then we're done, and it becomes an annual event after that.
Okay. And one more question. Businesses. We're talking about individuals for the most part here.
Right.
Anything special businesses need to be doing now to prepare for all this?
Well, there's a couple things that are important. First of all, the great majority of large businesses provide health insurance for their workers. They need to do that to attract quality talent. They don't need to be doing too much today. But when we get into the smaller businesses where jobs are often created, as we well know, we're helping businesses that have fewer than 25 employees by offering them the opportunity to purchase insurance through a special marketplace, we call it the SHOP, that has its own plans that will be available, has an 800 number, and there's a tax credit available that can be worth as much as 50% of the employer's contribution. This is important. If I want to start up a company and try to challenge Google, Google can give health insurance cheaply because they're a huge company. I can't. Now I'm going to have that opportunity. I think that's going to be very important.
And again, for businesses, healthcare.gov, get your answers there?
They can go there, and that'll take them to the small business site.
Well, there's a lot of information there, David. Thank you so much for joining us, and we will see what happens come October 1st, 2nd, 3rd, and on forward.
We sure will.
Thank you.
Thank you.
Over $5 million in federal grants have been awarded to community organizations in Arizona to help those looking to enroll in the health insurance marketplace. Now, much of that money is going to the Arizona Alliance for Community Health Centers. Joining us now is the organization's Senior Director for External Affairs, Tara McCullum-Plesh. Good to see you again. Thanks for joining us.
Thank you.
Community organizations helping people enroll. How?
Well, most of the community organizations that are collaborating with us on this effort have done eligibility and enrollment for years and years. These are people that have had a lot of expertise in this, primarily signing people up for Medicaid and for kids care. So this really isn't a lot different. They know the process extremely well, and so they will be looking for those folks who are eligible for Medicaid, and then those that are eligible for the marketplace, they'll move them on to a navigator who will be able to help navigate them through that online eligibility system.
So there's a difference between the first contact and a navigator?
Well, actually, the assister can talk to them about where to go to find the marketplace and basically tell them some basic information that they might want to have when they go through that marketplace online, but they don't actually do the assisting for the marketplace itself.
And that's where the navigator and the
that's
brokers
where a
as well?
navigator can come in. And here's the distinction.
Yes.
The navigators can help them through that online process and explain to them what they need to be looking for in a health plan according to their income, their family size, their zip code. There are a number of factors that they can remind them. And if they have a chronic disease like diabetes and they need special medical attention or special medical equipment or prescriptions, then they're going to be looking for that on that marketplace when choosing a plan. But the navigator, neither the navigator nor the assister can choose a plan for them because that would be conflict of interest. That would be a broker. If they can't make a decision, then a broker can step in and help them decide between all those health plan choices.
Navigators, especially brokers, how certified? How much are they overseen? What kind of regulations going on here? What are you seeing here?
Well, all the assisters and all the navigators have to be trained. They have to go through extensive training and then take a test to be certified. And once they get that official certification, they'll actually have the document, then they're ready to go and they help people.
What questions are you hearing now? We're just right here at the doorstep of opening this thing up.
Right.
What questions do you hear most?
I think the question we hear most is, does everybody have to go to the marketplace? No, not everybody has to go to the marketplace. If you already have health insurance, then you more than likely don't have to go to the marketplace. If you have Medicare, TRICARE, are on Access, any number of other health care coverages, you don't probably would not want to go to the marketplace.
And I didn't ask David this, but I guess I should have. If you go to healthcare.gov,
right,
and you say, I've got, will they tell you to go away? You don't need to be here.
No, they won't tell you to go away. But you won't get any of the tax credits or the subsidies that you could get if you're not being covered presently.
Okay.
So if your employer is already giving you health care benefits and your premiums, they're what you have to pay aside from what the employer pays, is less or more than 9.5% of your income, well, then you can go into the marketplace and you may be eligible for some subsidies and tax credits. Otherwise, if you're really not paying that large of a percentage for your portion of the health plan, then you are not probably eligible for the marketplace.
Okay, yeah, I just wanted go away, leave us alone. We got other people to deal with here.
They'll be kind about it,
yeah.
I'm sure.
The challenges now in enrolling and helping people enroll, I mean, language challenges, cultural challenges, just the ability to understand what to do and where to go. What are you expecting?
Well, I can speak for our community health centers, which have a lot of translation services in many, many languages, not just Spanish. But even on healthcare.gov, when you call the number for healthcare.gov, you can request to do the application in a specific language. And I believe I heard that they have over 105 different languages on healthcare.gov.
Okay, so that kind of information is out there. What
Right.
about those who are worried? I'm giving a lot of personal information on a website or to people that I don't know, even the navigator helping me, I don't know this person.
Right.
The fraud, the concern over fraud, is it out there? Is it realistic?
I think fraud is realistic because there are going to be a lot of predators out there who are going to look for people that they can offer assistance to do the marketplace. But the only place that you can sign up is on healthcare.gov, no other place. So people need to be aware of that. There is also a fraud line if you go to healthcare.gov. And if somebody is trying to scam you, you can go to healthcare.gov and report that.
Oh, interesting.
Yes, there
Okay.
is a place to report the fraud and abuse. Now, as far as privacy concerns with our navigators and our sisters, part of that training process and their certification requires them to sign a confidentiality rule. And yes, most of these people are well vetted. There are background checks because many of these people are already employees either in our health centers or in those community organizations. These aren't just generally people we've pulled off the street and said, okay, now you're in a sister. They've gone through an extensive process in order to do this, and they sign off on a privacy agreement.
We've got a little bit of time here left. I just need to know, from the community health center's point of view, are you ready? I think everyone thinks it's going to be a stampede here come tomorrow, but that's not necessarily the case, is it?
Well, I'm hoping that's not the case, but we are ready. We are prepared. We have our navigators and our assisters in place, but I think that we're going to have, it could be one of two scenarios. I'm hearing that a lot of people think October 1st is the only day to enroll, and it isn't. If you enroll, and I think you heard this from David, if you enroll anytime between October 1st and December 15th, after that January 1st deadline, you will be enrolled in a health plan. And if you still have through March 31st to enroll anyway.
Okay, so do it between now and December, or it'll be done?
My piece of advice would be to wait till mid or late October. Let people kind of work out the bugs,
Yeah.
and then go on.
Well, we'll check back with you in a few weeks, maybe a month or two, and see if any bugs are rearing their little heads. Thank you so much for joining us.
You're so welcome. Yeah.
Tomorrow on Arizona Horizon, we'll take a closer look at the Yarnell Hill Fire Report released over the weekend, and we'll find out about ASU researchers, how they're using Twitter feeds to help measure public opinion. That's Tuesday evening, 5:30 and 10, right here on Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of 8, members of your Arizona PBS station. Thank you.